Hi, I'm Dr. Jedrzejewski, and I'm here today to talk to you about facial masculinization. So our initial consult will either be over the phone, through video, or in person. We'll talk about what to expect in terms of surgery, but also how best to prepare for surgery and what to anticipate in terms of recovery. We will review your medical history carefully, as I want you to be as transparent as possible regarding both your medical and social history. That's the only way that we can address your specific concerns and work with you to move forward with. Hi, I'm Dr. Brianna Jedrzejewski, and I'm here today to talk to you about facial masculinization. Our initial consult will be either over the phone, through video, or in person. At that time, we'll talk about what to expect, not just in terms of surgery, but how to best prepare for surgery, and also what to anticipate in terms of post-op recovery and wound care. It's really important that we review your medical history carefully. I want you to be as transparent as possible regarding your medical and social history so that we can address your concerns and work with you to move forward to surgery in the safest way possible. My number one priority is to ensure your candidacy for safe surgery and to optimize your surgical outcome. This means minimizing risks such as wound healing issues, bleeding, adverse reactions to anesthesia, and other complications. So let's start with bleeding. We'll take a look at your medications and make sure that you're not taking any medications that could increase your risk of bleeding during surgery. This includes NSAIDs such as aspirin, ibuprofen, and naproxen. We'll probably have you stop taking these medications about a week from surgery. And Tylenol would be fine to keep taking if you need something for pain relief. That won't increase your risk of bleeding. In terms of smoking or nicotine in any form, such as vaping, we ask that you avoid that 6 weeks prior to surgery and 6 weeks following surgery. This is because nicotine constricts tiny blood vessels that we rely on to help you heal from surgery. In terms of weight, I don't have a BMI cutoff for facial masculinization. It's just important to know that if you have a higher BMI, you'll have a higher chance of needing revision surgery, particularly in the lower part of the face. You may have problems with anesthesia. And if you have any comorbidities like heart or lung problems, then we need to either resolve these or optimize them with your PCP prior to surgery. It's important to note that if you have a stable weight 3 to 6 months prior to surgery, that will help you yield the best aesthetic outcome. If you happen to be a type 1 or type 2 diabetic, we'll ask for a recent A1C in order to see if your blood sugars are within a range that's safe for surgery. High blood sugar levels can lead to problems with wound healing and increase your risk of infection. If you have any autoimmune issues, we'll want to look at any medications you take, including steroids, which are known to inhibit wound healing. If you have HIV, we'll want to make sure that your CD4 count is appropriately high and that your viral load is appropriately suppressed. If you have any personal or family history of blood clots or adverse reactions to anesthesia, this will be really important for us to know so that we can keep you safe during the surgical procedure. If you're on hormones, it's completely fine to continue them. In terms of allergies, I'll want to know if you have any allergies that you know of to drugs or medications or anything else. In terms of prior surgeries, it's important to know if you've had any surgeries in your face before, or if you've had any facial trauma, which you didn't get surgery for, that's also important for us to know. In terms of social support, this is really important to have in place around the time of surgery. Surgery is a physiological stress on both the body and the mind, and it's not uncommon to have feelings of negativity, depression, anxiety post-operatively. Studies have actually shown that the strength of one's social support network can significantly enhance recovery after surgery. Everyone's social support might look different, whether it's family or friends or chosen family or your mental health provider, but it's important to have a plan in place for who is going to support you as you recover from surgery. Before moving on to physical exam, I want to know what your goals are. Facial masculinization is a highly individualized surgery which can address singular or multiple components of a patient's face. However, it is much less common than facial feminization surgery. You might ask yourself, why is that? The reason is kind of multifold. in the sense that when someone wants to masculinize their face, if their gender expression includes testosterone, oftentimes that will allow facial hair to grow on the face, which helps in terms of preventing people from getting misgendered, or might masculinize their face to their desired gender expression. There also might be cultural norms where it's very common for individuals who want to feminize their face to go through very invasive procedures with extensive recovery. And that's just not the cultural norm at this time in terms of facial masculinization. But all of that aside, if facial masculinization is something that is going to help you alleviate your gender dysphoria, then absolutely it's something that we can do for you. In terms of a masculine face, the aspects that are important to note are that masculine skulls or faces tend to have a larger forehead with more prominent bone deposition over the frontoorbital ridge. They usually have a larger nose, flatter cheeks here, maybe a more hollowed look right under the cheeks, a longer chin, a more prominent Adam's apple, a more square face with a prominent jaw. So facial masculinization surgery can be as simple as placing implants, or it could be as extensive as operating on the entire head and neck and taking all day. Some patients come with a very specific idea of what they want to address, and others will want to know all the possible interventions that can be offered to them. I'm always happy to give you my opinion, but ultimately my goal is to tailor the operation to address what you think is important. So I'll ask you first and foremost what you like about your face, and then I'll ask you to tell me what areas of your face cause you dysphoria. For the purposes of this video, I will address what a full facial masculinization would entail, breaking down the face into horizontal thirds. Starting with the top third of the face, we have the forehead and the eyes. So forehead contouring might involve placement of an implant to accentuate the frontal orbital ridge here, or the temporal area to give more of a square appearance and allow for the illusion of a prominent bony ridge. So an implant can also be fitted to create a hooded, more masculine look to the eyebrows here, so that they appear to sit lower than traditionally feminine eyebrows, which sit at or above the brow bone. So the procedures in the top 1/3 of the face are accessed through a coronal incision, which goes from ear to ear and lies hidden in the hair. The coronal incision is closed with staples at the end of the procedure in the hair-bearing area. And if a drain is placed, it is usually removed on post-op day 1. So moving to the middle of the third of the face, we can address the nose and the cheeks. Everyone's nose is unique, but in general, noses can be considered more masculine when there's a dorsal hump present, a more bulbous tip, neutral rotation of the tip, enlargement of the nose in both length and projection, larger nostrils, and wider dorsal aesthetic lines. In order to build up the structure of the nose and to provide adequate support, we may have to use cartilage grafts, which might come from cadaver rib if we're not able to harvest enough cartilage from your septum. So moving on to the lower third of the face, we have the chin, the jaw, and the neck. So the chin and the jaw are approached through an incision inside the mouth. Masculinization of the chin might include increasing the width of the chin, the height, and or the projection, using either your own bone with screws and plates or with implants. And you can also add volume with fat grafting in some situations. Typically, masculinization of the jaw includes widening it at typically prominent areas like the gonial angle and potentially the body of the mandible through fat grafting. Some patients will benefit from submental liposuction, which involves an incision below the chin, and this could just be to help contour the jaw. For patients who desire a prominent thyroid cartilage, also known as an Adam's apple, chondrolaryngoplasty in the form of addition of cartilage can be performed to enhance it. This would involve an incision approximately 1 inch in length, which would be placed in a natural skin crease higher up in the neck. And that would allow us to access the anatomical location where cartilage would be added, keeping in mind the need to avoid damage to nearby vocal cords. Now that we've addressed the entire face, I want to reemphasize that not every procedure may be necessary or even appropriate for every patient. Ideally, I would like to help you transform aspects of your face that cause you dysphoria and preserve the structures that make you look like you. Every single procedure comes with risks, and the more procedures you undergo, the more risks you are taking on. Hopefully, by the end of our consult, we will have arrived at a surgical plan that will help you fulfill your embodiment goals. About 1 to 2 weeks prior to surgery, we'll have our preoperative visit, either over the phone or in person. We'll review and confirm the surgical plan, and you'll receive prescriptions for your pre- and post-operative medications for pain and nausea. By this time, you may have also completed a head x-ray to help us with surgical planning. On the day of surgery, you'll arrive 2 hours prior to the start time of your procedure, either at the hospital or the surgery center, depending on where you've been scheduled. You and I will meet, and you'll sign a consent giving me permission to proceed with the procedures we've agreed upon. You'll also meet your anesthesia provider, who will answer any questions you might have about that particular aspect of the surgery. So facial masculinization surgery can take anywhere from 1 to 12 hours, depending on the procedures that we've selected. Although we inject local numbing medication during the surgery, you can expect to have some pain and swelling postoperatively. It's important for us to get your pain and nausea under control because this will help decrease the risk of bleeding. If you've had forehead or jaw work, you will wake up with a compressive head dressing, and that will help reduce pain and swelling. Patients with forehead or jaw work will stay with us at least overnight, possibly 2 nights. And once you discharge from either the surgery center or the hospital, we ask that you stay in the Bay Area for at least 7 to 10 days, which will be the timing of your first postoperative appointment. After that visit, we'll remove any splints and sutures. And depending on how your healing is progressing, we might also remove staples from your head if you have them. You'll be given a course of prophylactic oral antibiotics and an antibiotic mouthwash for the first week after surgery, especially if you've had jaw work done or any kind of intraoral incisions. In terms of activity restrictions, the most important thing to restrict is your level of stress during the postoperative period. A relaxed and stress-free environment will enhance your recovery and also reduce your risk of postoperative complications like bleeding. For the first week after surgery, we recommend sleeping with your head elevated and reducing your salt intake to help swelling in your face. Arnica can be taken to help reduce bruising and swelling as well. If you underwent jaw surgery, we recommend initially starting with a liquid diet and then moving to a soft diet for a month. None of your food should be crunchier than mashed potatoes or scrambled eggs for the duration of that time. It's important to avoid hot foods as you can more easily burn the inside of your mouth due to reduced sensation after surgery. If you have a scalp incision, please avoid harsh hair treatments or curling irons for the first 2 months for similar reasons, which is that you have reduced sensation of your scalp. No blowing your nose or bending over for at least a month if you've had rhinoplasty. In terms of restrictions on activity, no heavy aerobic activity for 4 to 6 weeks after facial masculinization surgery. It's okay to walk around. In fact, we encourage it, but definitely avoid attending crowded events like concerts or playing sports or attending any situation with the potential for collision or altercation. It's really important to avoid nicotine in any form for 6 weeks after surgery to reduce both your risk of infection and delayed wound healing. You can go back to work as soon as you're no longer on narcotic medication. For remote workers or light duty accommodations, if that's possible, this could be as soon as 2 weeks, but most people take at least 3 to 4 weeks. Keep in mind that you'll probably feel comfortable with public appearances by 4 weeks after surgery, as bruising and swelling will be significantly better by this time if you've had a more invasive procedure. Swelling of the nose, chin, and jaw can take up to 3 months before 80% of that swelling is resolved, and the rest of the swelling takes up to a year to resolve. You can see your final results within 9 months to a year after surgery. If any revisions are needed, they can be done after the year mark. The risks of facial masculinization surgery are similar to any surgery, including pain, infection, scar, including hypertrophic scar and keloids. if you happen to be prone to them. Asymmetry, no one's face is completely symmetric. So as we try to make your face as symmetric as possible, there's always an understanding that at baseline, there are slight asymmetries that you will likely continue to see post-operatively as well. There's a possibility for contour deformities anytime there's liposuction or fat grafting. There's a risk of hyper or hypopigmentation of your scar, which you can help prevent by wearing sunscreen and avoiding the sun at your incisions. Dehiscence, which means separation of your incisions, delayed wound healing, which can follow that, numbness, hypersensitivity, bleeding. There's a 5% chance of bleeding that would require a return trip to the operating room. There's a potential for hematoma, which is a collection of blood, or seroma, which is a collection of fluid your body makes at the time you make a space that wasn't there. There's potential for damage to surrounding structures and need for additional procedures. There's risks of anesthesia, which include blood clots to the legs and lungs and even death. There's a risk of regret for various reasons. The current literature shows that the risk of regret for gender affirming surgeries is quite low at less than 1%. To put this into perspective, other elective non-cosmetic surgeries, such as knee replacement surgery, has a rate of regret of 10%. We can talk about this more in person if that's something that you have concerns about. Risks specific to facial masculinization surgery depend on the procedure that you include in your surgery. If you have augmentation of the thyroid cartilage, that has a risk of partial or complete loss of voice. This is usually temporary, but can be long-lasting. Facial paralysis is a risk of surgery anytime you're operating in the face. This is also usually temporary, but can be long-lasting. After a coronal incision, it's possible to have areas of hair loss due to shock of the hair follicles. This can take 9 months to 1 year to fully resolve. Complete hair loss is very rare. Almost all patients experience some numbness of the chin and forehead if you've had surgery in those areas, which is usually temporary. However, the older the patient is, the longer it takes for nerves to recover. If you've had fat grafting, there may be a need for additional fat grafting, as somewhere between 50% and 80% of the fat that we inject at the time of surgery survives. This is really normal in terms of just fat grafting as a procedure. It's hard to predict whether you'll be someone who keeps 80% of the fat we give you versus 50. So you might need additional procedures for that reason. In terms of follow-up, after the initial postoperative appointment, I will see you at 6 to 8 weeks post-op, and then again at 3 months post-op to make sure healing is on the right trajectory. We would love to see you again at 1 year post-op, either virtually or in person, to assess the final result. At the time of the consult, I will answer any questions you might have. If you have questions that arise after the time of the consult, you can always contact our office and we will be happy to provide you with more information. We also encourage you to submit ideal photographs of what you envision for your results so that we can make sure we are on the same page at your postoperative appointment. Following the consult, my team will begin the insurance authorization process and will contact you within 2 weeks to discuss timing of surgery or any items that still need to be completed prior to surgery, like a letter of support or any kind of imaging. Thank you so much for taking the time to review this consult for facial masculinization surgery, and I very much look forward to meeting you.